Hi, I'm Dr. Pergande with Thrive Chiropractic and Wellness Center, and in today's video, we're going to be discussing the two most common types of headaches, tension and migraine headaches. We're going to be talking about how they're different, but I'm also going to share with you 6 underlying causes or triggers that they have in common. So tension headaches, these are going to be bilateral. That means both sides. You're going to feel these across the forehead, into the temples, and it very often wraps around to the back of the head as well. These are going to feel dull, achy, kind of like there's a vice around your head. Now, these are usually mild to moderate in intensity, and there's not usually a lot of other symptoms associated with a tension headache. The most common thing that people will complain about is having neck pain and sometimes sensitivity to the scalp itself, like it's actually tender to the touch. Now, certainly you might have some sensitivity to loud noises and be a little bit irritable. You do have a headache, but for the most part, there's not a lot of other symptoms associated with a tension headache. Compare that to migraines. Now, migraines are typically only on one side of the head, and they're more throbbing, pulsating, and pounding in nature. And these are more moderate to severe in intensity. And these headaches can last anywhere from 4 to 72 hours. Now, by far, migraine headaches are some of the most debilitating types of headaches. And one of the reasons for that is because they're often accompanied by additional symptoms. People will often complain about nausea, vomiting, extreme sensitivity to light and sound, visual disturbances. Some people will experience dizziness or shakiness, numbness into their face. They find it very difficult to concentrate, much less hold a conversation. And unfortunately, migraines are very common, especially among women. They are 3 times more common in women, especially women in their 30s and 40s. Now, whether you suffer from tension or migraine headaches, they do have several underlying causes or triggers in common. A very common underlying trigger for headaches is going to be dehydration. Now, whether you suffer from headaches or not, I'm going to recommend that you drink about half your body weight in ounces every day. So if you weigh 150 pounds, that means you want to strive to drink about 75 ounces of water every day. Now, another underlying trigger can be going too long between meals or skipping meals. And what this does is this drops your blood sugar, and then a hormonal cascade follows that triggers these headaches. And so you need to make sure you're eating every 3 hours. So you're going to have breakfast, lunch, and dinner and have snacks in between. So make sure you have snacks with you throughout the day. Now, another underlying cause and trigger is going to be food, especially inflammatory, highly processed foods, and just overall having a low nutrient diet. So we're going to recommend that you focus on eating whole, real foods. You want to avoid processed foods, especially foods with artificial flavors, colors, sweeteners, and things like MSG in them. And you may want to consider doing what's called an elimination diet. Now, an elimination diet is where you'd eliminate certain foods for a period of time and then slowly reintroduce those foods to see if a specific food is a trigger for you. Now, another underlying cause for headaches is going to be poor sleep. Now, we always recommend that you strive to get 7 to 9 hours of sleep every night, but this needs to be quality sleep. So if you're having problems falling asleep, staying asleep, you're real restless at night, we need to figure out what is the underlying cause of your poor sleep and address that. Now, another underlying cause is going to be stress. I don't know if I need to tell you this, but most of us are very stressed. Actually, I think most of us are so used to stress that we don't even realize we're stressed anymore, but our bodies know. And our bodies are telling us something's not right. And as this stress builds up, it can trigger a headache. So what we need to do is we need to incorporate de-stressing habits and rituals into our lives. And so like on a daily basis, I highly recommend things like deep breathing, meditation, prayer, keeping a gratitude journal, and then incorporating things like massage, acupuncture, and chiropractic to help your body adapt to stress. Now, last but certainly not least, a very common underlying cause for headaches is going to be a misalignment in your upper neck. And that's because misalignments in this area can put pressure and stress on your brainstem and spinal cord and cause a lot of neurological compromise. It also tends to lead to tension in your neck and shoulders. Now, there are about 200 to 300 doctors across the country, like myself, who specialize in correcting misalignments in the upper neck. So I highly recommend that you see one of these doctors to find out if an upper cervical misalignment could be an underlying cause of your headaches. Now, whether you suffer from tension or migraine headaches, it really is important to understand that these headaches are telling you that something's going on deeper inside the body. As a doctor, it's my job to figure out what are those underlying causes and address the underlying cause, not just treat the symptoms. Now, if you suffer from tension or migraine headaches and you'd like to consult with me, feel free to give my office a call. If you know someone who would find this information valuable, feel free to share it with them or tag them in the comments section below. All right, you guys, we'll talk to y'all soon.